Okay, so good afternoon to everyone and welcome to our online event. Let's start by adding a gender lens to our event by watching a video from the Foundation of European Progressive Studies about how the inequalities on health and care services affect particularly to women. So don't miss this video.
Imagine living in a world where heroes are invisible. Well, this is not fantasy, this is simply our world. Throughout our lives, we depend on care. It's something we cannot do without. It took a global pandemic to make us realise how crucial these care workers are for our well-being and our economies. But despite the applause, care jobs are still undervalued and underpaid. Carers continue to work in precarious and vulnerable conditions. And who are the ones at the forefront? Women, often from underprivileged backgrounds and migrants. Most care work is not even paid at all. The essential everyday tasks at our homes remain invisible and unacknowledged. They are performed by an overwhelming majority of women. Socially constructed gender roles are behind these inequalities. The resulting physical and emotional toll inevitably prevents their economic independence. We have realised care is essential. Now we have to act on it. Our economies, our lives cannot go on forgetting that paid and unpaid caregivers are the ones that cover our most basic needs. We must value them with impactful policy changes, with a cultural and political shift in the way we organise our societies. We need to move away from a profit-driven model of growth to a care-driven model. It's time for a care revolution. We need to care for care.
Well, such an interactive and informative video. So hello to everyone. My name is Alicia Oms and I'm the president of the Young European Socialists, but also a member of the European Parliament from PSOE. And today I'm doing this live streaming from my office in the European Parliament. And first of all, I want to thank all of you for joining us today and showing your interest on the topic on health and care services. So why did we pick today to do this online event? There is an important reason behind it for us. It's because today is the European Day for Solidarity Between Generations. And you could have picked any live stream for this evening, but you choose ours and we are really thankful for that. We, the Young European Socialists, together with the European Senior Organization, with whom we have been working since 2017, we wanted to bring up together a topic who concern to all of us, and it's a priority for both generations, that is health and care. You are also welcome to check the reading materials that we will be posting on the comments on Facebook Live that I really recommend you to read. So they will be there in the comments. So for the next 40 minutes, we will be debating about the EU's role in health, EU's approach to healthcare, the guaranteeing universal access to affordable and quality healthcare to all citizens, strengthening EU's competences and policies in the area of health, and also the particularity of women in the forefront of care. So now I would like to introduce our main speakers and representatives of the organizations which made possible this event. We have today together with us Jos Bertrand, European Senior Organization President from Belgium. We also have Maria Joao Rodriguez, FEPS President and a reference as a woman and a politician from Portugal. We also have Helen Frison, PES Vice President and also an S&D colleague from the Parliament from Sweden. And I'm very happy to introduce also three very special guests. As first, he comes from Luxembourg, but represents us all making a great work as Commissioner for Jobs and Social Rights. So we have Nicolas Schmid with us. So hello, Commissioner. we are also proud to have with us today another committed socialist, Frank Brandenbroek, Belgium Deputy Prime Minister and Minister of Health and Social Affairs. So welcome, Minister. And last but not least, we have also Lynn Segal, Professor of Psychology and Gender Studies from the Birkbeck College, feminist scholar, writer, and activist. So welcome, Lynn, to this event. And thank you all for joining us today. First, I would like to give the floor to Jos Bertrand, who is going to explain to us the origin of this action that we made together. So please, Jos, the floor is yours.
Yes, thank you, Alicia. Also, I am Jos Bertrand from Brussels, and I am here from the smallest organization in our socialist family. Nevertheless, we represent more than 30% of the votes and 30% of our party members. Yes, it's the third time that we work together with Young European Young Socialists, because solidarity is important for us, and solidarity between generations is very important. And indeed, we already saw it in the video. The COVID-19 concerns the core of our socialist engagement, create societies which care for each other and where no one is left behind. It's very important for us. And we have seen very good examples last year as the European Union contribute to these initiatives. The SURE program that supports people who lost their jobs. We develop the development and the purchase of the vaccines. That's also a European initiative. And the COVID recovery plan, where we as socialists are very important. And were very difficult discussions. As always, we had to compete against nationalist reflex. But solidarity means working together, and that's what we want to do. Young people, when talking about care, young people are finding work in care and healthcare. But the undervaluation of many care professions has led to labor market shortages in many member states. We observe that labor migration is used to fill this shortage, which in turn leads to a shortage in the countries of origin. And this problem needs attention on both European and at national level. And many elderly depend on care. Too many elderly people went in collective rest homes too early because affordable, adapted housing becomes too expensive or care is not present. The Union can make financial resources available for this recovery plan for adapted housing for elderly, linked to care and age-friendly environments. And finally, COVID has hit the elderly as well as the youngsters. Seniors were confronted not only with the loss of social contact, but also the loss of trusted service and care. Accelerated digitalization, but has also created problems. There was a discussion about the right to access of healthcare, and we also were faced with staggering statements. And this concerns ESO's demand for a European action plan against ageism. We as ESO contribute to the Commission's consultation on the Green Paper on Aging. And we thank our sister organization for sharing our concerns. Remember, it's very important. Today's young people are tomorrow's seniors. And today we are drawing policies that we hope will become reality tomorrow. I will now give the floor to Maria Joao Rodriguez. And we thank and the FEPS also for this contribution. And afterwards to Helene Fritzon, Vice Chairwoman of the S&D Group in the Parliament. Thank you.
Well, Maria, I will ask you a question also. And then to Helen also, I will ask both of you. So, Maria, in 1 minute, how is leading the progressive think tank in this topic that we are talking about today? And did you like our intergenerational initiative related to health and care when you first saw it?
For sure, Alicia, great pleasure. We, Foundation of European Progressive Studies, we have been working with all our organizations, from the young people, from the senior people, because we believe that right now with the COVID crisis, all of us, we are under test. not only for our lives, but also for the way we live together in our societies. And we should be proud because so far the solidarity among generations is working. We are protecting each other. And at the end of the day, we need to think, all of us, in a certain moment, will have these needs of health services and care services. So we FEPS, we are very pleased that we are working with you and also preparing the future. And the future means we should build together a European health union, and together we should develop a real care services sector supporting men and women. This is our first message to start with.
Thanks a lot for this strong message, Maria. And now moving to Helen. Well, first of all, how is it going, your parliamentarian week in Brussels? And also the question in 1 minute, what would you highlight about this initiative that we are presenting today?
Thank you so much, Alicia, and thank you for the invitation. Yes, we have a session here in the European Parliament, so it's very intensive with debates and discussions. And I'm so proud to being invited to this seminar. So, because this is an opportunity to take a step back from the current crisis and look ahead to the long-term challenges and opportunities in the field of health policy. It is important for us as policymakers to connect with the experiences of young people and older people when it comes to healthcare, because I think that these two groups face specific challenges which need to be addressed to ensure equal access as outlined in the Principle 16 of the European Pillar of Social Rights. And from the beginning of this pandemic, PS and S&D, we called for the establishment of a European health union as a core component of a social Europe. And this means elaborating joint responses to common threats like pandemics, but also, and that's important, increasing the quality of care everywhere in Europe. And you know, I'm from Sweden, and in Sweden we have since many years ago built a welfare state with on reforms and with common taxes. So I would like to see that we can raise standards all over Europe for the benefit of young and old alike, quality public services for all, including healthcare, at the core of our PS social action plan. So thank you so much for this opportunity, Alicia. Thank you.
Thank you, Helen, for your contribution. And now we move to our special guest. So we will start with the first one. And as a fan of your work at the European Commission, Mr. Schmidt, you have been very active in promoting a social Europe, including via the recent action plan for implementing the social pillar. So what does the social pillar mean for health and care?
Thank you. Thank you very much, Alicia. Thank you also for inviting and for organizing this seminar, which is, especially in the present context, very important, very helpful, and also in the preparation of the Porto Summit. Well, the social pillar has a comprehensive approach, and health is obviously also an important element of good social policy, because we are all striving for a healthy society, and healthy societies are normally also societies where social equality and fairness is better established. Now, on the health, the social pillar principle number 16 states that everyone has the right to timely access to affordable, preventive, and curative healthcare of good quality. And this should be possible for everyone in our society. And therefore, first element is that we have to provide these services, which means that we have to invest in good healthcare. And this is the last years in the recommendation the Commission gave to member states. This was also sometimes a recommendation to invest more in our healthcare, in hospitals, in good healthcare. Because even if in Europe healthcare is better established than in other parts of the world, there are big differences between health systems among the member states. Now, this has obviously got a very special dimension in the pandemic, and we have seen how crucial a good health system is to face the pandemic, because a lot depends on the capacities of our health systems, of our hospitals, but also on the staff in our hospitals. And here I think I have seen with great interest your presentation on the care workers, on the care professions. And I think we have really to thank and to pay tribute to all those working in this sector. And it is not acceptable that many of them, a large majority being, by the way, women, and it is not acceptable in our societies to undervalue this work, this care work, which is essential for the well-being of our societies. Just a few remarks. Children, the child guarantee, we have discussed it yesterday night in the parliament. There is a strong element also on children's health. And we know that poor children very often are in bad health because they have bad nutrition. They have not always the same health services. Another issue which I'm dealing with is occupational and health and safety at the workplace. With the pandemic, this was a big issue, and it is still an issue where people could be infected because they had not the right equipment, they had not the right protections, they did not get the tests. And therefore, now we have to make sure that they get the vaccination. And so health and safety at the workplace is extremely important. And together with the parliament, we are working on the permanent adjustment, adaptation of the directives to better protect workers at their health, at their working place. And finally, I would just repeat, the more unequal a society is, the worse the situation of health is in this society. And there are a lot of literature, and I remember I attended meetings together with Kate Pickett, who is a UK researcher, and she showed in a book how equal societies are also good for a high level of health. And I think as Social Democrats, this is something we have to aim at. Thank you.
Thank you, Commissioner. And now we are moving to you, Lynn. We are absolutely thrilled to have you contribute to this event. A strong female and expert voice like yours is of a tremendous add value and would certainly shake up this discussion. So my question would be that it has tragically taken a worldwide pandemic to remind us of the importance of vital, robust care services and of the interdependence of all human beings across ages, genders, classes, and ethnic origins. So what should be our main lesson from the current experience to build back better through a people and well-being oriented approach, leaving no one behind? Lynn, you unmute yourself.
Hello, Alicia, and hello to one and all. It's wonderful to be here. I'm honored to be at this year's annual FEPS conference on intergenerational support for care. Care, that's the first thing that we know, isn't it? That care is now the key agenda of the moment. And as your video showed, and we all know it shouldn't have taken a global pandemic to tell us that, because we are men and women, young and old, wherever we come from, we all have shared vulnerabilities. And yet what we know, extraordinarily, despite our vulnerabilities, is that care itself, the need for care, has been devalued always historically, but never more so than today, when we've had that invasive, unregulated market in the UK, for instance, taking over our care services, outsourcing them, outsourcing even our health services, which have created around Britain, and I'm sure elsewhere, huge care deficits and widespread carelessness. So it's seeing that we know we simply have to act, knowing that we need both to be able to receive care, but also to be in a position to give care, which is very hard to do when our care services have been outsourced and we have so little control over them. So it's necessary both to give and receive care, just to realize our shared humanity, to ground us in the world, a world we share with other people, and not just become solipsistic individuals on some treadmill of life. So what this pandemic highlights so crucially then is, first of all, obviously our interdependence, but also, as Nicholas Schmidt just said, what it also shows is that we have to connect everything up. We have to connect up the intersections of life, work with home, with society, with concern for the world at large, which actually was the topic of the last FEPS annual conference, wasn't it? So what we need to see at once are the harms of inequality, the harms of neglect. So as we've heard, all good social researchers know that actually the simplest way of dealing with this pandemic, indeed the simplest way of dealing with future pandemics and all the harms besetting us, is to reduce inequality, to raise welfare benefits. That would be the first simplest way, actually, of saving lives. So tackling COVID and producing future pandemics and other global threats means what it is to actually create a caring economy in a genuine caring world. That's something many feminists have written a lot about. We have in Britain the Women's Budget Group, which has been writing about that for many years. And I could say a lot more, but I'll finish here just saying we begin from our interdependence, our shared vulnerability, our need to combat inequality, and above all, our need to value care and not simply see it as the work that women do, and not ever see it as unskilled work, because care requires time, imagination, creativity, all the things that once you outsource it to global corporations or markets can't be adequately dealt with. And that's what has created the care deficit that we see at the moment, and the need for, a global care chain of people, women moving around the world from poorer countries to richer countries, trying to meet this deficit, but meet it in ways which become wholly inadequate because they are so easily exploited and unable to deliver the sort of care they'd like to deliver.
So thanks a lot, Lynn, for your contribution. And now we will move to our Minister van der Broek. We have seen, I know you have a tight agenda, so we are really happy and we really appreciate your time for being here with us. So I have a quick question for you. Belgium has been in the forefront of a solidary solution to get through this pandemic crisis altogether. So, Minister van der Broek, you have been one of the most outspoken supporters of a European Health Union, calling for a Europe that cares and that is seen to care. So, do you think the past few months have strengthened the arguments for greater integration of health policies?
Yes, thank you, Alicia, for giving me the floor. And I'm sorry, I have to rush away immediately after my intervention. Sorry for that. But my answer to your question is wholeheartedly yes. Yes, we do need greater integration of our health policies at the EU level. And let me explain this simply by reflecting on three lessons which I learned from this pandemic. First, strong national health systems are key in our European social model. That goes without question. But strong national health systems are also crucial for effective crisis preparedness and response capacities. So we must continue to invest in them. And there is political momentum because we all understood the importance of well-organized care systems. So we must do this. But that also requires a pretty fundamental shift in the EU's approach to healthcare. Whereas healthcare has often been perceived as a cost factor in the European economic and budgetary governance, so a cost factor to be contained and to be restrained. I think now the Commission underscores rightly the vital importance of health as a productive factor. Where our health is in danger, our economies are in danger. And so let us keep this in mind and also maybe remind the Commission of this during the upcoming discussions on the future of the European semester and the Growth and Stability Pact in post-COVID times. So that's my first point. Secondly, European cooperation is absolutely essential. You know that the Commission put forward this EU Health Union package, and there's a number of proposals in that package, including legislative proposals that will, I think, substantially improve our capacity to coordinate our responses to health crisis. For instance, the idea of the declaration of a European health emergency as a trigger for enhanced cooperation at EU level, and also reinforced EU coordination powers, I think that will be very helpful. The EU's role in facilitating the purchase and distribution of vaccines is obviously a very clear test for us member states on how the EU deals when it has to address a policy domain that is quintessentially about solidarity, where stakes are high and political choices are highly visible. And obviously, over the last few months, we've seen weaknesses in the EU's approach, weaknesses vis-à-vis the producers, the demands that had been formulated vis-à-vis the pharmaceutical industry. Yes, that is true. But on the other hand, I think we all know that there is simply no alternative. There is no alternative to a European approach. And so let's all engage to draw the necessary lessons and improve our European cooperation. And then there's my third lesson, which is about research and unmet research needs. Doing more research into the already known coronaviruses, MERS and SARS, was just not worth the investment by the private sector from an economic or a commercial point of view. Looking back, it could have changed 2020 completely if it had been done. And so this is a market failure par excellence. And so to overcome such a market failure, public authorities need to step in. And on that premise, we should discuss on how to involve the pharmaceutical industry in a constructive way and which contribution could come from that side. So that is why I fully support the Commission's call to establish a dedicated European authority to strengthen our preparedness and our response capability for new and emerging cross-border threats to human health. It's a so-called HERA, the Health Emergency Preparedness and Response Authority. So with our Belgian experts, we're working on some very concrete proposals on the establishment of HERA. And we think that a new balance of fairness and equity must be found between the public funding of HERA on the one hand, and the profits private companies make from HERA-supported products on the other hand. And of course, investments in preparedness activities and products without knowing whether they will ever serve should be rewarded, should be supported, should be paid for. But given the principle that citizens only have to pay once for, say, the R&D of a product, the public investment through HERA should be reflected in the price of the end product. These are complex discussions, but we have to address them. So let me conclude. I think I'm confident that we will move further away from the cliff of this pandemic and upcoming pandemics, but we have to count on strong European collaboration and coordination, but coordination based on strong national health systems. So addressing the resilience of our national systems, addressing unmet research needs together will really bring us forward in a post-COVID world where lessons have been learned and we will all be safer. Thank you for listening to me. And as I said, Alicia, I'm sorry I have to leave. It was great to meet some long-standing friends here, but alas, I have to quit. But I wish you a successful seminar. Thank you.
Yes, thank you, Minister. Now you can hear me. I'm aware, Minister, that now you have to leave to go also live, but in Belgium TV. So thank you very much for your time, Minister Van der Broek, and it was a real pleasure to have you with us today. So now we are moving to another campaign and also questions for the speakers. On this year, International Women's Day, our sister organization, the PS Women, brought together women on the coronavirus frontline to call for fair deal for them. So this campaign was named Make Her Count and included video testimonies from women who are frontline workers. So we are going to listen now the first testimony from Maria, a social worker from Hungary.
Kelet-Magyarország kisvárosában élek, szociális gondozóként dolgozom. Számunkra a pandémiás helyzet egy nagyon megterhelő feladat, plusz felelősség számunkra, hiszen az idős ellátásban napi szinten kihívás számunkra feladatok ellátása. Országos szinten láthatjuk, hogy a fertőzöttek száma növekszik, míg itt a kisvárosunkban tapasztaljuk az önkormányzat által ingyenes teszteléssel, hogy mennyire vissza tudták szorítani ezt a helyzetet. Az én városomban ez egy pozitív példa. Több megbecsülés a nőknek, több odafigyelés a szociális dolgozóknak.
So now, Lynn, I would like to ask you, if you can answer in 2 minutes, that would be great. So the question is, in the wake of COVID-19, the need to acknowledge our mutual interdependence and vulnerabilities is more urgent than ever. So rather than continuing to treat it as an exploited form of labor, mainly shouldered by women and the most precarious groups, how can we make sure that care becomes collectively valued and shared? And what potential does it entail in terms of bridging the gap between generations?
Right. Yes, well, certainly, as we're all saying tonight, and COVID has just made so clear, we begin now, as most people have not begun before, from acknowledging our interdependence. Though again, as I've said, it is something feminists did tend to talk about, feminists often being mothers, being the main carers and so on. We knew that caring for others was sort of seen as our job. And so, we needed to have something to say about it. But I think another thing that's crucial is general education and training around care, beginning from the early years of schooling to revalue care, but also to understand that caring to be done well isn't something that can just be hived off to be done privately in the home. Caring to be done well wherever it's performed, whether at the home, at the private home or in any other sort of elderly home or anywhere else, always needs backup and resources and training and respite care. Because care can be actually something that is incredibly rewarding, which is also something that very much is about generational issues, because the person who might be offering the care, perhaps the mother, perhaps the nurse, perhaps the person working in the care home, actually can realize that they're doing an incredibly important and meaningful work, even though it's always been so undervalued and underpaid. And it contrasts a lot, actually, with what many of the jobs people are doing, endless auditing jobs and so on, what David Graeber, the late David Graeber, referred to as bullshit jobs. You know, you're not doing a bullshit job if you're caring. And the other thing to remember and talk about, and that brings the generations together, is that caring is always an interactive process. I mean, you only have to think of the mother and her child, but it's not just the mother and her child. You know, I know many carers who've cared for, you know, the most ill and difficult elderly people who, you know, when that person dies, you know, is utterly bereft. So the point being that I made before, we all need both to care and to feel cared for. That's an interactive process. It's a meaningful, important work that means really turning upside down the way in which we've looked at and valued jobs, the way we've thought about employment and labor. And caring is, of course, something that can be done by the young and the old, that is done by the young and the old, though usually women, although, you know, more men are joining in that today. And you know, I think once we see it as this crucial, interactive, humanizing process that grounds us in the world, we can see its value. But as well, another thing that brings young and old together is simply thinking about the future of the world itself. So a lot of young people are very involved in green politics and concerned about climate change, you know, and you do see them together on those pickets and protests demanding that something be done to create a more sustainable world. So these are all issues, I think, which help unite us, young and old, together, and to see that, you know, care is the rock on which we all stand.
So thanks a lot, Lynn. And now I would also like to use this testimony to ask you, Helen, also in 2 minutes, do you think there are wider lessons that can be learned from Maria's testimony regarding the role of public services during the pandemic?
My answer is absolutely, because Maria's testimony is a powerful reminder of how difficult this past year has been for the millions of workers in the front line in healthcare and care rules, and the majority of them are women, but also more generally, those public servants who have worked especially hard to keep our societies functioning despite the health crisis. These workers deserve our thanks, especially those in the healthcare sector like Maria. So these are mainly female professions. I'm proud that Peace Women put together this video campaign to shine a light of those who may have been undervalued at times. So by pushing for the implementation of the social pillar, PS and S&D aim to improve working conditions all over Europe. And as a social democratic political family, well-funded public services that are accessible to all have always stood at the heart of our demands. And I hope the pandemic has given others the opportunity to rethink their attitudes towards publicly funded healthcare, social care, and education. And it's time for this now to recommit ourselves to public services, not withdraw into our own bubbles. And finally, because I'm a former mayor in a city, and I know the important aspect of the adaptability of the local public services. And I will therefore also take the opportunity to thank the thousands of local politicians, mayors and councillors who have also been on the front line of the pandemic. It's a very strong work. Thank you so much.
Thank you, Helen. And now I would like to pass to a video with a testimony from Nora, an elderly care nurse from Finland.
Moikka, mä oon Noora, mä oon 31-vuotias ja työskentelen vanhushoitolaitoksessa. Ja työskentelen alalla, jossa on tosi pieni palkka, koska olen nainen ja olen hoitoalalla, niin ilmeisesti meille naisille saa naisvaltaisella alalla maksaa pienempää palkkaa vain sitä varten, koska me olemme naisia. Ja tähän täytyy tulla muutos. Me hoitajat olemme mitä sukupuolta vain, niin ansaitsemme korkeamman palkan siitä työstä, mitä me teemme, koska nykyajan vaatimukset ovat korkeammat, mitä ehkä on ollut 50 tai 60 vuotta sitten. Lisäksi olemme joutuneet kohtaamaan maailmanlaajuisen pandemian eturintamassa siinä, missä sairaalatkin. Se on myös koskettanut meidän arkeamme, koska vaikka sairaalat ovat saaneet ensimmäisenä maskeja ja suoravarusteita, niin mekin olisimme tarvinneet niitä yhtä kipeästi, koska vanhusten hoitolaitoksissa ei ole mitään suojamuuria, joka estäisi koronapandemian saapumista niihin. Emmekä pystyisi siellä suojautumaan mitenkään pandemia vastaan, koska emme pysty lukitsemaan muistisairaita huoneisiinsa omissa kodeissaan. Tarvitsemme ihan samanlainen koulutusta, maskeja ja suojautumista sekä sitä, että kaikki muistaisivat siellä vieraillessaan noudattaa niitä yhteisiä pelisääntöjä. Naiset ansaitsevat korkeamman palkan sen takia, ei vain sen takia, että olemme naisia, vaan sen takia, että olemme kouluttautuneita, sen takia, että me olemme töissä ja me olemme uhrautuneet siskojen, veljien, äitien, isien puolesta, että kaikilla olisi turvallista. Naiset ansaitsevat ihan yhtä suuren palkan kuin miehetkin.
So very interesting video. So the question is to Commissioner Schmidt, because I know he has a really tight agenda also. So faced with aging societies, is more important than ever to make careers, health and care attractive to young people. So what can the Commission do to help to this process?
Well, I think this is what the young lady from Finland has told us is fundamentally important, because the first thing we have to do is to value the professions of care, because care is an essential part in our society. And Lynn Segel has very well described how essential this is in a society where people are living together. We are human beings who live together, and therefore care is an essential part of our humanity, of our human character. And therefore care is also a rewarding job. But it's only a rewarding job if people get the feeling that their job is recognized, that it's valued. We are speaking about wage, obviously. It is unacceptable first that there are still differences between women and men. Therefore, the Commission has made a proposal on wage transparency. We have really to end this fundamental inequality between women and men. But it's also working conditions. Especially now we hear how many hours people in the care sector work under difficult circumstances because of the pandemic. And why? Because staff has been cut all the years. And Minister Van den Broek has said, well, because the health system, the care system have been considered as cost factors. And just to reduce cost, well, investments have been reduced, but also the number of staff has been dramatically used. And the workload of people in the care sector is immense. And not only because of the pandemic, but it was already very heavy before. Now, what to do about young people? To show them that this is an important role in our society, that we are doing something for this profession, that we give them opportunities to be skilled. I fully agree to say that care work is not very high skilled work. Wrong. I think it's a very highly skilled work. And that's why it's not understandable why it is not valued, because when you are doing care work, be it with children, be it with elderly people, or be it as a nurse in a hospital, in the health system, this requires not just technical knowledge, but it requires something not everybody maybe has, because these are the soft skills, the way how you are in contact with people. And I think this is an area, by the way, which offers a lot of jobs, and our society will need more care. We can do a lot, introduce a lot of robots in our industries, in our factories, in our offices. But at the end, when it is a question of people relationship, when people have to meet, when people have to be taken care of because they are old, because they are sick, or because they are children, you need human persons. And I think this is something we have to invest in. We have to invest a lot in their skills. And therefore, I think that as this sector will create a lot of jobs in the future, unless our societies fall apart. If this is the choice, well, that's something I and our political family should never accept. This means that we have to motivate young people to take this option. And I heard what Lina said about the bullshit jobs. Certainly, care is not a bullshit job. Care is something which values your personality. And when you go home in the evening, you may be tired, but finally you have the feeling that you have done something extremely valuable for society or for just another person or other person. So I think this is a very important issue. And thank you very much, Alicia, for putting that on the agenda. And I think this is an issue for our political family. We have really pursue and have the courage to say that this is something we have to spend money, because this is not a cost, this is an investment. Thank you.
Thanks a lot, Commissioner. That was a very hopeful contribution, and I'm happy to say goodbye to you, which has an important message to our audience. Thank you very much for joining us today, Commissioner Schmidt. We do really appreciate your willingness and disposal always toward YES and the PES family. So thanks a lot for being with us today. And now I would like to watch our last testimony from PES Woman Campaign, Make Her Count. This testimony is from Anna, a pediatric nurse from Germany.
Mein Name ist Anna Schäffler. Ich bin von Beruf Kinderkrankenschwester. Ich arbeite in Deutschland auf einer perinatalen und pädiatrischen Intensivstation. Seit Corona hat sich mein Leben sehr verändert. Anfangs war die Angst riesig, sich an Covid-19 in der Klinik anzustecken. Das hat sich sehr gelegt, seit der vielen präventiven Maßnahmen, die getroffen worden sind. Weiterhin bin ich jedoch sehr darauf bedacht, mich in meinem privaten Umfeld nicht anzustecken, um meine kleinen Patienten nicht zu gefährden. Das hat natürlich große Auswirkungen auf meine Familie. Vor allem leiden meine Kinder sehr darunter, da sie gerne noch mal ungezwungen mit ihren Freunden spielen würden. Jetzt im Homeschooling sehen sie eigentlich niemanden mehr und ich bin plötzlich nebenberuflich zur Lehrerin, zur Pädagogin, zur Psychologin und zur Spielkameradin geworden. Nebenher läuft natürlich auch der Haushalt, der für viele selbstverständlich von uns Frauen auch geführt wird. Für diesen Nebenberuf gibt es aber weder Anerkennung, geschweige denn Lohn. Ich würde mir wünschen, dass wir einfach mehr Anerkennung bekommen, da für viele trotz Gleichstellung, die viele denken, dass wir Frauen das einfach alles wuppen. Am Ende des Tages bleibt für mich aber so gut wie keine Zeit. Aber man sieht das ja auch in unserem Beruf. Im Gegensatz zur Industrie ist unser Gehalt deutlich geringer. Auch die Schichten werden geringer bezahlt und Wochenende oder Feiertage auch. Dabei arbeiten wir doch mit dem höchsten Gut, was wir haben, dem Leben. Deshalb wünsche ich mir auch in der Gesellschaft eine größere Anerkennung für unseren Beruf, der mit deutlich höheren Gehältern einhergehen müsste.
So now I would like to direct this question to Maria Joao. In 2 minutes, we have seen that FEPS has been working intensively since November 2019 with its network of members foundations to monitor the EU gender equality policy agenda through a progressive lens focusing on its care dimension. So why has FEPS made care such a key area of concern, and what is the contribution that FEPS wishes to give to our political family?
Well, Alicia, as you could see by this very impressive statement coming from Anna in Germany, Anna is just an example of millions of other women in Europe who are the real pillar of our societies. Because look at Anna, she's doing a double job. She's providing care to her children at home, and then as a job, she's providing care to elderly people. And without persons as she is, our society will just not survive. So in FEPS, when we start this work, is because we really believe that we need to have a feminist society with a real equality of rights between women and men. But this is impossible to provide if we don't recognize that care work is vital for our societies and should be organized in the professional way with full recognition, full pay, good working conditions, and also shared between men and women. So we FEPS, we are addressing a kind of last taboo of our societies, but this is our role. We are not afraid of difficult issues. We really believe that if we want to provide these equal opportunities between men and women, this should be completely reorganized. First of all, by developing a professional care services where jobs are fully recognized, paid, working conditions, with access to training, financed by public services as local levels, and underline this, the local authorities are extremely important for this. And on the other hand, we are also pushing for what Van der Boeken just said as a minister and Nicolas Schmid. We need to have a European Health Union providing access, universal access to healthcare to everybody as a right. So in the end, well, I would say this also is a central consequence of the European social pillar, because all of us as European citizens, we should have good working conditions and equality men and women, but we also should have access to care services and health services. So this is my last message.
Thanks a lot, Maria. And before going to the conclusions, I would like to bring a last question to the organization leaders. So in 1 minute, is the COVID crisis an opportunity to change the paradigm and bring out a caring economy, society, and democracy? Please reply in the following order that I'm going to say. We have first Jos, then Maria Joao, and then Helen Frickson. So Jos, you can start. You need to unmute, Jos.
Yes,
No.
My answer is yes, but it depends on us as political family, because solidarity is not a certainty in this society. And it depends also on our conviction that for us, caring societies are important or crucial, and caring societies where nobody is left behind. Nobody should be left behind. It's important. And I think, therefore, it's not only important to have good ideas, and we have them, but we need to convince the other people. And therefore, again, We have the ideas, but we should also go to the people and listen to the most vulnerable people. In the COVID crisis, we had the elderly who were living alone and not together. They were in very alone, solid in their homes. And I think we have to listen to this one. And therefore, for me, social democracy and socialist being, it is not only have our visions, but also it's an educational project. We need to convince people to go to the people with our message. And that's for me important. I say yes, but it depends from our conviction. Thank you.
Thank you, Jos. Maria?
Look, it's very simple, Alicia. I think a care society is part of our vision of what should be a society, because we need this to have full solidarity between generations. We need this to have full equality, men and women. So we count on young people to say clearly, this is the kind of society we want to live in. This is my message.
Thank you, Maria. Now, Helen.
Thank you. And of course, yes, it is an opportunity. And first of all, thank you so much for the video where Anna, Maria, and Nora, they could tell us everything about also the gender perspective. Thank you so much for that. And I will tell you that PEACE recently adopted a declaration and a policy publication outlining our vision for a post-COVID world centered on well-being. And of course, it is about job, it is about financial secure and access to quality education, to healthcare, to childcare, and a good life. So I will end with that the first step on the path to intergenerational solidarity is the realization that we all want similar things for ourselves and for our children. The next step is to identifying how we can make it possible, our common interest, in order to hand over a more sustainable society to our future generations. So thank you so much, Alicia, for this seminar. Thank you.
Thank you, Helen, and thank you very much to all of you personally, and also to your staffs in your organizations for making this initiative possible. So hope to see you next year again. And now to conclude the discussion, I would like to give the floor again to Lynn by also asking a question. I'm asking many questions today, but we will close also with a question. So Lynn, we are arriving at the end of today's discussion. And I'm reverting back to you as a renowned feminist scholar engaging on the topic of care, having co-written the Care Manifesto with the Care Collective and authored many other related publications, but also an engaged feminist activist for a wrap-up and a call to action. So why should care be at the center of the contemporary politics, and why should it be at the heart and center of progressive political action?
Well, I think it's clear from what we've all said that care needs to be at the center of our politics if we're to have any worthwhile or sustainable future at all. And so many people are saying that, young and old alike. So I think I would conclude by saying what I feel I'm working for in all the spaces I'm working could be reduced to 4 premises. Firstly, we have to transform both the worlds of paid and unpaid work by genuine sharing in and beyond the domestic sphere, with entitlements to paid caring leave for all. And that also means shorter hours in paid work. And secondly, it means providing, as we've all said, universal basic care tied in with expanding an inclusive healthcare system, which is locally run, not outsourced to the corporations. with a well-trained, well-paid workforce, which would be employing both young and old alike. And we also need universal care in the sense of prioritizing our care for one another at all ages. That is really what life is about, educating people for caring skills, along with the necessary investments this entails in our physical and social infrastructures, our human infrastructures. And thirdly, it means that we all need to support our already existing structures and create new eco-socialist alternatives to current systems of production, consumption, and exchange, able to confront those predatory global corporations that can make it so difficult to do the sort of caring work we want to be doing. So both young and old in the UK have been arguing for a while that this means insourcing, bringing back into public ownership what has been outsourced and what we have so little control over in the public sphere. But it also means encouraging the sorts of mutual aid that we've seen during this pandemic and opening up spaces for alternatives, whether they're alternative markets, alternative public spaces. And then finally, shared solidarity for creating a healthy and caring world means refocusing always on economic policies that avoid austerity and avoid income inequality. And that means fairer tax systems and, of course, concern with environmental sustainability. So I just conclude saying that, as many feminists have said, one coming to mind is Joan Tronto. Caring means caring for, that hands-on care that most of us can be doing, or caring with, just being there for others who need us, but also caring about. So now, for instance, it means caring about the terrible pandemic in India at the moment. They've produced a lot of our vaccines, but they're not able to get it to their very own people. So, a new caring world just begins from that sense where I began, of interdependence and shared vulnerability, creating what we need locally, but also knowing that we have to be aware of what's happening globally, because that's just necessary for, as I said, any worthwhile and sustainable future. So I really welcome this event, and I've learned from it. I'm sure we all have.
For sure we had. Thank you very much, Lynn Segal. It has been an honor to have you today with us. I think your contribution has been really impressive, and we will definitely follow your work. So thank you to all the speakers and to all the participants. We really appreciate it a lot that you spent this time with us. So for that and for future events, please don't forget to follow us through the different social media channels, but also to subscribe to our newsletters to receive updated information and stay tuned with our work. And of course, share the ideas with your friends and with your family. So stay tuned to PS, to YES, to ESO and FEPS yearly discussion on the need to bring about intergenerational solidarity. So hopefully see you again next year. Goodbye to everybody.